Let's look at another COVID-related study. And remember, we approach all studies with the same skepticism, and you're going to see me apply that here as well. There's a study that says nearly 17,000 people may have died from taking hydroxychloroquine for COVID. Now, you might remember that hydroxychloroquine was one of the things that many right-wingers were promoting. Trump started promoting it. Others started promoting it as well. And we very quickly figured out it doesn't work for COVID. Take a look at this. This is from The Hill. Nearly 17,000 people across 6 countries may have died because they took hydroxychloroquine during the first COVID wave, according to a new analysis published by French researchers. Hydroxychloroquine is that anti-malaria drug that was being used off-label to treat COVID in some places. It was also proposed as a preventative measure, a prophylactic of sorts. In February and March, it was widely promoted based on preliminary reports. Subsequent studies showed not only it had no benefit, it increased the risk of death. Now, researchers from France and Canada looked at people who got hydroxychloroquine. They did an analysis and they found an estimated 16,990 excess deaths in these 6 countries, likely attributed to hydroxychloroquine use. Now, I want to be super clear. The people doing the study admit it actually may have been more than 17,000. It actually may have been fewer deaths than 17,000 from the hydroxychloroquine. They also have determined that there were 2 ways in which pursuing the hydroxychloroquine could lead to death. One is by taking hydroxychloroquine and not following the standard of care for COVID, you might have been foregoing treatments that we increasingly knew did help survival. And then number 2, there are also cases in which the hydroxychloroquine itself seems to have hurt the body in a way that made it less able to fight off the virus. Now, I'm being consistent here. The Brett Weinstein 17 million vaccine deaths thing, totally bogus, totally debunked, unbelievable in every way. We should also look at this study with some skepticism. These are results based on excess deaths. And whenever you are looking just at excess deaths, you need to go to attribute those deaths to any particular thing. You need to go further. So this study suggests that there were deaths related to hydroxychloroquine. It is not proof of it, but the important reminder here is Donald Trump said, try it. What do you have to lose, right? I mean, what's the harm? The harm is both that the hydroxychloroquine itself appears to have been damaging, and also those who opted for the hydroxy, in many cases, were foregoing treatments that we knew increased survivability and improved outcomes. And that also played a role here. They love to talk about how now that we know everything we did wrong during COVID, we know hydroxychloroquine worked and the vaccines didn't, and we didn't need to do that. We didn't need to do this. The more I look at what we can now say definitively, the more it seems as though these lunatic right-wingers were very, very wrong. Now, I'll be the first to say there were downsides to the social isolation. There were downsides to closing the schools. I don't believe for a second that it was handled perfectly. It was an emergency situation with incomplete information. And there's a difference between saying, with incomplete information, let's do the things that science says give us our best shot, versus with incomplete information, let's do the most destructive and erratic things we can think of, up to and including nothing at all. Very big moral difference between the two. Let's take a quick break. Much more coming up after this short break.